Dozens of doctors across Virginia are getting behind a bill they say will save patients money on prescription drugs and give them better health outcomes. A prescription drug affordability board would be able to set price limits in some cases. Lawmakers killed that bill last year, but with Democrats in control of both chambers this year, it could be different.
We are speaking out because we are tired of seeing patients suffer.
Dr. Roman Ahmad represents 100 doctors, including 25 from Hampton Roads.
Virginians deserve better than to roll the dice with their health care just because of high drug costs.
Dr. Greg Gelberd told reporters how those high prices nearly cost some patients their lives.
She came into the emergency room with a sugar of over 600 and stroke-like symptoms. She confessed to me in the ER that she had chosen between food, rent, and insulin and had dropped the insulin.
Dr. Rochelle Klinger shared a story about a man she treats for a mental health disorder.
Finally, in his mid-40s, he was stabilized on a long-acting form of a medication and got a great job with a company that offered health insurance.
But co-pays were unaffordable at $875 a month,
resulting in a relapse, hospitalization, the loss of his job, going back on disability, and loss of his relationship with his wife.
A prescription drug survey released by the Wasson Center in Newport News last July shows 3/4 of voters support legislation to create a prescription drug advisory board that could set limits on how much patients have to pay for medications. Pharmaceutical and biotech industries are often opposed to such boards. Another survey prepared for the trade group Pharma reported 3 in 5 adults reject the idea of governments setting medicine prices once they learn about the trade-offs. Often that's described as the incentive for innovation that would create new cures in the future.
Now, a similar bill died in the General Assembly last year. Governor Glenn Youngkin strongly opposed it. Supporters are hoping again that they'll have more luck this year with that new legislature in place.